This young lady's here today for a photofacial. Photofacials are FDA approved for browns and reds, and what that means is it will even out skin tones. Some of the nice side effects of photofacials, even though we don't advertise as that, they do help to refine pores. It minimizes fine lines and wrinkles and does do a little bit of skin tightening. But the main advantage for photofacials is this light wave in particular is looking for browns and reds on the face. So people that have severe sun damage, age spots, it's a very good treatment. People that have rosacea, this is really the treatment of choice for those kind of problems. It takes the red out. You're going to need several treatments for rosacea, probably doing a series of 3 to 5, and then possibly going on a maintenance program where every 2 to 3 months you do a treatment. When you're doing age spots and sun damage, we're looking at usually starting with 3, and most people can do quite well with that, but some people may need more, and there may be some people that need less. As far as, is this a painful procedure, it feels like the snap of a rubber band, and most people tolerate it quite well. Some people need a little topical, but most people do very well without a topical medication for the pain control. So I'm going to, this young lady, we're going to use Palomar. We're using the Palomar Starlux technology. They actually are in the forefront of intense pulse light. They were actually the inventors of intense pulse light back in 1992, I believe. So we're going to get started here. We do have our clients where we put little pads on the eye so we can get as close to the eye as possible. And this machinery has a self-cooling head, so we do not have to use any sprays or gels. We just actually cools the skin down quite nice. It's a little faster due to the fact that we're not having to pull anything off of this product. So as we go over this thing, we overlap slightly. How's that feeling? Fine. Good. It takes us about a half an hour to do a face. We can do face, neck, arms. We can do just spots by itself. Beautiful results on hands with photofacial. We can most of the time take care of those little spider veins around the nose and on the face with this technology also. Okay? Mm-hmm. As far as aftercare instructions, there really is no downtime with photofacial. You may have some redness. If you have significant brown spots on your face, those will get darker. That's a very good sign to us. We love to see the browns get darker. That's a very good indication that you're going to see a wonderful result. That can sometimes take up to 2 weeks for those to come to the surface of the skin and to flake off. You can wear makeup. We send you home with a product on your skin and a sunscreen to protect your face because you're going to be more sensitive. But we can do most areas of the body. We can do, again, neck, chest. The décolleté area is a very big area for sun damage due to the fact that we're not thinking about that area, and we expose it every day with the shirts we wear, and we don't wear a sunscreen. So we send everybody home with a sunscreen, and most people tolerate this very, very well. There's very few adverse side effects. Can someone get a blister or an irritation? That can happen. I personally have not seen that, and I've been doing this for 4 years, but that can happen. And those are all things that can happen. Hyper and hypopigmentation, all of those problems usually resolve themselves over a period of time. So this has very, very few risks. But we really need to think about having someone that is experienced at looking at the skin and getting a good diagnosis of what's going on with the skin and what's the best treatment. And photofacial is the treatment of choice, again, for rosacea, sun-damaged skin. It helps significantly. It's a good place for someone to start.